Valley Health Partners Street Medicine is a medical service for patients who are unstably housed or without a home to go to. We have a dedicated team of professionals going out to our patients, providing direct care on site with the idea of providing high quality clinic care wherever the patient feels comfortable.
You're safe here.
We carry everything that we need to see our patients in our backpacks, including medications to dispense on site. What we really believe as a team is in giving grace and providing care with love.
Happy birthday to you. Happy birthday to you.
On top of the medical care that we provide with physician assistant staff and nursing staff, we also have social services, licensed social worker, behavioral health specialist, community health worker, and we don't do this service alone. We have multiple community partners that have access to other social services, including housing.
To me, it's really important to know where my patients come from and know some of their stories, and so I think in a lot of ways the patients that street medicine serve have been hurt by some way by the medical system and have had a bad experience, and understanding their point of view and where they come from, it's important to me to hear their stories and know how we can help from within the system.
They don't even have the benefit of an office or the normal equipment. They carry everything on their backs and they go into these homeless camps to take care of these people when they could really do anything else. That to me is the definition of service above self.
It's wonderful, it's great that they care enough to make sure that we're taken care of. They have people who donate things. If you need like blankets and stuff like that, they'll see that you get them. They do a lot of good. They help a lot of people, and they make sure that everybody has a fair chance of surviving out here.
I was having a rough time in my life. I was addicted to crack, and I was getting high while I was pregnant. I was literally prostituting for $20 pregnant, trying to get high. And they kept checking up on me under the bridge. I was homeless. And they kept telling me, like, you can do it, go to rehab, get clean before you have this baby so you can keep your baby.
Felicia is an amazing human being, and when we first met her, it was actually a referral from another patient who was living under the bridge, and we met her. She had been a victim of domestic violence, pregnant, and living under the bridge.
And they said, we'll stick by you through the whole thing. We'll stick by you through rehab, the Mommy and Me program, when you get out, when you have the baby. And like, they were so focused and like determined. They
asked us to reach out, get some blood work. I borrowed their Doppler, and so that was the connection, is that I was able to, I printed out a picture, I found her ultrasound, and I printed out a picture and then put it in a plastic sleeve and brought it down to her so she could see her baby, and then we borrowed the Doppler and she could hear the baby's heartbeat.
I was literally getting high one day and my baby was just kicking and kicking and kicking, and I hadn't eaten in like 2 days, and I'm like, what am I doing? And I finally got the strength to just get up and go to rehab. And I went to rehab and I successfully completed it. And I went to a Mommy and Me program for 6 months. And I successfully completed that. And when I had the baby, me and the baby both, neither one of us had drugs in our system. So Children and Youth never got called, and I got to keep my baby, and here I am now.